Can low testosterone exacerbate panic attacks?
That's a great question, and I'm so glad somebody asked that. So I will have a lot of patients reach out to me, and they're like, "Doc, I don't feel well, but I don't think it's testosterone because I can still achieve an erection." A lot of patients and even physicians equate testosterone or low T with only sexual dysfunction. And I have to say, testosterone, like where it works the best, it's in the brain. Testosterone does increase dopamine level. It does also act on the 5-HT2 receptor, the serotonin receptor. So a lot of my guys, what the first thing they will notice when I put them, again, it's not just testosterone. So for me, when I say treatment, it means we optimize their testosterone, we put them on the right targeted supplements, we fix their nutrition, we talk about their mindset. But for sure, testosterone is the biggest gun. But anxiety, panic attack is a huge symptom of low T. The same way when you look at women when they go into premenopausal or menopausal symptoms, one of the first symptoms they have is anxiety and panic attack coming out of nowhere. So now we see guys suffering from this. So to answer that question simply, yes, panic attack, anxiety can be a symptom of low T, maybe not the only one, it may be multifactorial, but it very likely can be, and the right approach to testosterone therapy with the right supplements will most likely help. And I have hundreds of patients' testimonials to be on this, because I spend a lot of time with my patients where I tell them, focus on what has improved in your life, not just the physical level, not just the sexual, because I know those will get better, but on the emotional side, on the, even like a lot of times drive, motivation, inner confidence. A lot of times once you gain inner confidence, that anxiety goes away. Anxiety a lot of times comes from a lack of self-confidence, and it becomes a vicious cycle. We can help it.